All right. Going to go over slow wave abnormalities on the EEG. Their significance and clinical correlation. So the objectives are here. I hope to enable the learner to identify abnormal EEG slowing, recognize features on the EEG that should suggest the presence of a focal process, and assist in helping you diagnose certain conditions that could give rise to focal and diffuse slowing on the EEG. Disclosures, none of them are relevant at all to this talk. All right, if you see slowing on the EEG, the first step is to determine, is this abnormal slowing or physiologic and normal slowing? So you need to evaluate the arousal status of the patient. Is the patient truly alert? Drowsy states can slow down the EEG. You should know something about dietary status. Hypoglycemia can produce slowing on the EEG. Know other medications. Medications clearly can affect the EEG. Also be mindful of technical issues that can give rise to slow wave changes on the EEG that may not be physiologic. And then age can affect the EEG as well. Temporal slow transients that can be seen during the aging process and is not necessarily abnormal in the temporal regions. And also in the EEG and the pediatric age group, you may see posterior slow waves of youth and other slow wave changes which are normal. Here's an example of normal slow wave changes not indicative of disease. This is slow roving eye movements in a patient during drowsiness. Here are the patients looking to the left, looking to the right, looking to the left as they're starting to drift into sleep. Here's a frontally predominant theta slowing seen during drowsiness. This is sometimes referred to as a frontal drowsy rhythm, occasionally seen, but not in everybody during drowsiness. I mentioned hypoglycemia can affect the EEG. This EEG was performed in a patient who was fasting during hyperventilation. It's common to see slowing during hyperventilation, but it can be accentuated in hypoglycemic states. Here's a recording of a patient, and the patient was given some glucose, and hyperventilation was repeated, and the EEG was normalized at that point. Medications can affect the EEG. This is a resting EEG in a patient.